Hello dear friends, welcome to Forensic Medicine by Dr. Paras, and now we are going to discuss the part 2 of toxicology, that is about the agriculture poisons. Agriculture poison, if we talk about, number one thing is insecticides. So most commonly used poisons for the suicide in India, my dear friends, that is insecticide. Insecticide, who does more? Male more than female. Male more than female. If we compare with this poisoning, we have to see hanging. Hanging, you see female more than male. But success rate of hanging. Male are more successful. Male are more successful in hanging. If male will go, he will go. Bye bye, tata. Example, insecticide poisoning, organophosphate poisoning, OP poisoning. Insecticides we can use. Sulfurs also, some people use sulfurs also, organophosphate. So remember, insecticide most commonly used poisons for suicide in India, male more than female. Example is organophosphate. Now another type of agriculture poisons we are having right here, sir, rodenticide. Rodenticide is organophosphorus poisoning. Two types are there, that is alkyl phosphates and aryl phosphates. Alkyl and aryl, two type of phosphates are there, alkyl and aryl. Alkyl phosphate, malathion. Aryl phosphate, parathion, diazinon. Parathion, diazinon. So two types are there. Organophosphorus poisonings are of two types. One is alkyl phosphate, another is aryl phosphate. Alkyl phosphate is malathion and aryl phosphate is parathion and diazinon. Now organophosphate versus the carbamate poisoning, my dear friends. Organophosphate versus the carbamate poisoning. The table is beautiful, table is there with us. Organophosphate is irreversibly inhibit acetylcholine esterase. Moment your acetylcholine esterase is inhibited, what will happen? Your acetylcholine level would be high. What level would be high, sir, here? Acetylcholine levels would be high. So irreversibly inhibit the acetylcholine esterase, which will increase the acetylcholine. Now carbamate, reversible inhibition of the acetylcholine esterase. This is reversible. This is again increasing the acetylcholine, but this is reversible, this is irreversible. Organophosphate will increase the acetylcholine. Moment your acetylcholines are high, which activity will increase, my dear friends? Parasympathetic activity. So example for organophosphate is malathion, parathion, diazinon, and carbamate will be LD carb, bagon, D carb. These are the carbamates. Carbamates are reversible. LD carb, bagon and D carb, these are reversible, but organophosphate, malathion, parathion, diazone, these are irreversible. Now antidote for the organophosphate poisoning is atropine and oximes. And in the carbamate poisoning, it will be only and only atropine. This oxime specially acts on the nicotinic receptors. That is why oximes, if they are symptoms, then they will be using the oximes along with that in the organophosphate. Now let's discuss this broad term parasympathetic and sympathetic, my dear friends. If we talk about the parasympathetic and sympathetic, we need to understand this way. If I just compare the two people right here, sir, what is parasympathetic and what is sympathetic? So let's draw the two people right here. First I'll write parasympathetic. First I draw, sir, parasympathetic, and this is sympathetic. Parasympathetic, which neurotransmitter we have, sir? Acetylcholine. Here we are having, sir, dopamine, noradrenaline, epinephrine, norepinephrine we are having. So in the parasympathetic, if I draw like this, what will happen, sir? See this. First I'll draw and then I'll let you know what is happening right here, sir. This is a beautiful drawing I am drawing right here for all of you. If I draw right here, sir, same diagram, same beautiful diagram I'll draw here. Chalo. So we'll draw a line. And you can see the line is coming on the GIT. Now what I say in the parasympathetic, what will happen? So above GIT everything will decrease and below GIT everything will increase. In the sympathetic, what will happen? Opposite will happen. That is, above GIT everything will increase and below everything will decrease. Let's see what is increasing, what is decreasing. So first let's check here, sir. If I say what will happen to the eyes in the parasympathetic, as I told, above abdomen everything will decrease. So we see, sir, here above abdomen everything decreases. So eyes will be small. This is called as meiosis. Then there will be a bronchoconstriction. Then on heart, your cardiac output and BP will fall. Then on GIT, which is below the abdomen and below abdomen, GIT secretions will increase, peristalsis will increase, and then coming to the urine will also increase. Then coming to the constipation of diarrhea will be there. Plus parasympathetic, there will be erection. If I compare this with the sympathetic, opposite will happen. So above abdomen in the sympathetic, what will happen? Your eyes will be dilated. That's a mydriasis. Bronchodilation. On heart, cardiac output, BP, heart rate will increase. GIT secretions decrease. Urine retention. Then there will be a constipation. And also in the penis there will be ejaculation. So this is a basic difference between the acetylcholine wala parasympathetic and adrenaline, non-adrenaline wala sympathetic, my dear friends. So parasympathetic acetylcholine level will be high. If any poisoning where acetylcholine levels are high, if acetylcholine level is high in the organophosphate and carbamate, the person will be coming to with the meiosis. Respiratory difficulty will be there. Plus there will be a diarrhea. Plus increase in GIT secretions. So these are the symptoms which you can see in the organophosphate because acetylcholine levels are high. And if acetylcholine levels are high, there will be increase in acetylcholine, the parasympathetic activity. Now, which receptors are there for the parasympathetic? If parasympathetic, little of the pharma will discuss. Parasympathetic, we are having M1, M2, M3, M4, M5. And in sympathetic, we are having alpha, alpha 2, beta, beta 2, D1, etc. receptors are there. Now we talk about the another topic. It smells like kerosene. So who smells like kerosene, my dear friends? Rodenticide smells like kerosene. Increase parasympathetic activity. Just now we have discussed about the parasympathetic activity. Sir, above abdomen everything will decrease. So eyes will decrease. Decrease eyes is called as meiosis. And heart rate, there will be a bradycardia. And GIT secretion, etc. it will increase. Then nicotinic effects will be there. Nicotinic. That is why we were using the oximes. Nicotinic effects are like muscle weakness, paralysis. Muscle weakness, paralysis can be there. Muscle weakness and paralysis can be there. CNS effects like tremor, headache, confusion will be there. CNS effect can also be there. That can be tremor, headache, confusions, etc. You can see right there. So different effects are there if there is a organophosphate poisoning. So basically, summary I can tell you, it smells like a kerosene first thing. Increase parasympathetic activity, my dear friends. If parasympathetic activity is there, then on eyes there will be meiosis, heart, bradycardia, bronchoconstriction also. If I say the bronchus, there will be a bronchoconstriction, my dear friends. Then secretions will increase. Nicotinic effects like muscle weakness, paralysis can happen. CNS, there will be tremor, headache, confusion. Now coming to the next thing is investigation of choice. Investigation of choice in this agriculture poisoning, you will see RBC cholinesterase is a specific test for the organophosphate poisoning. RBC cholinesterase is specific test. Plasma cholinesterase is a sensitive test. Plasma is sensitive. RBC cholinesterase is specific. And P-nitrophenol test. P-nitrophenol test is a confirmatory test. P-nitrophenol test is a confirmatory test. Confirmatory test, my dear friends. So there are the specific test, sensitive test, and the confirmatory test we have read so far, my dear friends. Now coming to the postmortem examination, the organ shows the congestion. There will be congestions in the organ, plus there will be pulmonary edema. Pulmonary edema. Because bronchoconstriction was there, patient was suffocating. Because of suffocation, lot of damage happened in the lungs, and because of that you will see the pulmonary edema. What treatment you can give, my dear friends? Treatment you can give oxins and atropine. Oxins and atropine. And atropine, remember one more thing, atropine acts at many places, and atropine is also a drug of choice for AV block bradycardia. AV block bradycardia. Now, atropine acts on both CNS and parasympathetic effect. Atropine is acting on parasympathetic and CNS effect also. That is why it is used. Oxim acts on nicotinic effect like muscle wasting, muscle paralysis, etc. Oxims can result in decrease in acetylcholine, my dear friends. Plus, gastric lavage is also done with potassium permanganate at concentration of 1:5000. Gastric lavage. You all know how to do the gastric lavage. First, you will take a sample while putting the evolved tube. Then this potassium permanganate is sent inside, put it inside. Then we put and then we wash out 2-3 times we have to do. And indication for doing this, the time limitation, gastric lavage timing is important. Timing is less than 3 hours. Less than 3 hours. Now coming to the next one is idrin. Idrin is also known as plant penicillin, my dear friends. Idrin is also known as plant penicillin. It belongs to organochloride compounds. Idrin, also known as plant penicillin, and it belongs to organochloride compounds. Mechanism of action, if we talk about, it will inhibit the GABA mediated chloride channel. GABA is a inhibitory neurotransmitters. And once neurotransmitter which are inhibitory, they are getting inhibited, then what will happen? CNS will be stimulated. For example, this is GABA. GABA is decreasing CNS activity. And now there is some drug, X drug coming. You say idrin is there, idrin is coming, idrin is acting here. And idrin is decreasing the GABA. Decrease in GABA. If GABA is less, what it will result in? It will result in increase in CNS. CNS activity will be increased. Now clinical features like adrin ke andar incoordination. In adrin, what clinical features you can have? Incoordination. Ataxia, convulsion, tremors, etc. will be there. Treatment of adrin would be what, sir? Gastric lavage. What treatment is basically given? Gastric lavage is given in the adrin. Adrin belongs to plant penicillin, my dear friends. Remember, adrin belongs to plant penicillin, belongs to organochloride compounds. Mechanism of action, it inhibits the GABA chloride channel, stimulates CNS. Clinical symptoms like incoordination, ataxia, confusion, tremors, etc. will be there. Convulsions, tremors, etc. Confusion can also be seen. Treatment is gastric lavage. Treatment is what, sir? Gastric lavage. Gastric lavage. Done, sir? Now coming to the next type of organophosphate poisoning, that is what's agricultural poisoning, that is sulfose. Sulfose, if you see, sir, the active compound is ALP3, alkaline phosphate, ALP3. Mechanism of action, it releases the phosphine gas. So sulfose is releasing the phosphine gas. Sulfose is releasing the phosphine gas, my dear friends, which will inhibit the cytochrome oxidase enzyme. Sulfose is an active compound, is alkaline phosphate. It releases the phosphine. Phosphine will inhibit the cytochrome oxidase enzyme. Cytochrome oxidase enzyme and smell is garlicky. Fatal dose is 1 to 3 tablets only, and cause of death in the self-force poisoning will be the cardiogenic shock. Would be what, sir? Your cardiogenic shock. Now treatment part, if we talk about gastric lavage, we can do, yes. Magnesium sulfate is given to neutralize the poisoning. Just to neutralize the poisoning of self-force, we give the magnesium sulfate, MgSO4 we give. Now corrosive poisoning, if we talk about, sir, next topic, corrosive poisoning. If we talk about the corrosive poisoning, we'll see acid and the alkalis. Who are more dangerous if the competition comes between acid and alkali? Who are more dangerous? Alkalis are more dangerous. Now you will see something here, sir. C for coagulative necrosis. Coagulative necrosis is seen in all solid organ except my dear friends, brain. So in brain, which type of necrosis is seen? In the alkali it is also seen liquefactive necrosis. Liquefactive necrosis. So if acid is there, there will be a coagulative necrosis, and if alkali is there, there will be liquefactive necrosis. Now inorganic acids like sulfuric acid, which is also called as oil of vitriol, sulfuric acid, then nitric acid is there, sulfuric acid is there, nitric acid is there. Sulfuric acid is oil of vitriol, and guys remember, nitric acid, they act locally only. Wherever you will put the nitric acid, there only they'll show the effect. Now sulfuric acid, oil of vitriol, sometimes we use this strongest acid. We use this as what, sir? Acid attack. And for acid attack, we have learned the IPC, that is grievous hurt with the dangerous weapon. Grievous hurt with dangerous weapon, 326A, 326B. A stands for acid attack and B stands for acid attack attempt. Now sulfuric acid we'll learn in bit detail. It is the strongest acid, my dear friends. Fatal dose is 5 to 10 ml and fatal period is 18 to 24 hours. See from where the person is ingesting per oral route, and moment it is going inside, it is burning everything. That is why black color is seen. Immediate cause of death is circulatory collapse, but delayed cause of death would be peritonitis. It will go inside in the peritoneal cavity. It will go. There will be a person suffering from peritonitis after that. Sign and symptom. What are the sign and symptom, my dear friends? Sign and symptom, first there will be a pharyngeal spasm. Pharyngeal spasm you can see. Chalky white teeth due to erosion. See, normal color of teeth is yellow. If I draw like this, your teeth, beautiful teeth, they are yellow in color because of the deposition of XYZ, momo, chutney, etc. But when there is a sulfuric acid ingestion, these yellow color will be gone. Why? Because strong acid will erode all these things. So chalky white teeth would be seen because of the erosion. Then mucosa and organs are black because of the inflammation, burning, because of the burning. The mucosa and the organs are black. Gastric mucosa will show a appearance called as blotting paper mucosa. Blotting paper. The gastric mucosa will show appearance as a blotting paper mucosa. So what are the sign and symptom? Pharyngeal spasm will be there, chalky white teeth due to erosion, mucosa and the organs are black, gastric mucosa, blotting paper mucosa. Now treatment. Wash with running water. First of all, you need to wash with running water. Then applying the magnesium oxide topically over the skin. Plus we can give the IV fluids. What is the fluid of choice? Fluid of choice, ringer lactate. Ringer lactate. How to give? Total body surface area involved multiplied by weight of the body. Total body surface area involvement, the weight of the body, if adult is there, we multiply by 2. Then what will happen according to the ATLS guidelines? ATLS guidelines. Sir, x by 2 is given in first 8 hours. After that x amount will come. And another x by 2, first x by 2 and second x by 2 is given in 16 hours. And gastric lavage. Gastric lavage is contraindicated because it can cause a perforation, and here gastric lavage you don't have to do. A very simple answer. The gastric lavage is contraindicated because it can cause the perforation. Now coming to the next one is nitric oxide, nitric acid, HNO3. It is also called as fortis or tehzab. Tehzab bhi bolte isko. This can also be used as what, sir? Acid attack, tehzab. Mechanism of action, the tyrosine will form the picric acid. The tyrosine will be forming the picric. Tyrosine is what, sir, here? Amino acid, and amino acid will be converted into the picric acid, which is not good. Cause yellowish discoloration of the skin, mucosa, teeth and the tissue. Everything will turn yellow when it comes to the nitric acid. When it comes to the nitric acid, everything will become what, sir? Yellow. Due to hematin production, mucosa and the urine becomes brown. And after that, due to hematin production, heme is there will be a mucosa and the urine which will become brown. Now coming to the next, organic acids. Organic acid, if we talk about organic acid acts both locally and systemically. So number one, we have to talk about the oxalic acid. Oxalic acid is also known as acid of sugar, and it is used as an ink remover, my dear friends. Oxalic acid is most commonly used as an ink remover, and fatal dose is 15 to 20 ml. You have used this like if stains of ink are there on your clothes, to remove that we use the oxalic acid. Now clinical feature, if we talk about, oxalic acid can lead to hypocalcemia. Plus there will be a vomitus, that is coffee brown vomitus, and oxalic acid crystal cause renal stone. Plus it can cause a renal failure. Renal stone, oxalic acid crystal can cause renal stone, renal failure. Treatment, if we talk about, sir, calcium gluconate 10%, IV route. And wall scraping, because walls, the paint, etc., putty, they contain the calcium. Because of that, a person will be scratching that, maybe biting that nail, and that calcium is going inside, gives him satiety, my dear friends. So calcium gluconate 10%, wall scraping because it contains the calcium. Now next is carbolic acid. Carbolic acid. Okay. And why it is causing hypocalcemia? Because oxalic acid has a special property. Oxalic acid binds with calcium, which will lead to hypocalcemia. Now sir, carbolic acid we talk about. Carbolic acid is also known as phenol. And phenol, which is used as antiseptic. We all know phenol we use day-to-day life, my dear friends. Phenol, very much common, we use for the cleaning floor, etc. Clinical feature will be pupil will be constricted, my dear friends. This is organophosphate poisoning mimicking acetylcholine parasympathetic. Pupil will be constricted. Dark green color urine is seen. If there is a carbolic acid, which is also known as phenol. Phenol is something common name, you should be remembering by the name of phenol. Carbolic acid or phenol. If phenol is there, my dear friends, then dark green color urine will be there. In cartilage, onchronosis is seen. In cartilage, you will see onchronosis. Onchronosis will see. In cartilage, you will see onchronosis. What is onchronosis? There will be a black discoloration. Black discoloration of the cartilage. Cartilage, my dear friends. Then leathery mucosa is seen. Another feature can be leathery mucosa. Plus carbolic acid delays the decomposition of the body. If person dies because of the phenol, then there is a high chances that there will be a delay in the decomposition of the body. What is decomposition? decomposition, or you can say putrefaction, because carbolic acid is a antiseptic. It will kill the bacteria. Bacteria is responsible for decomposition, so it will delay it. It will delay it. This will delay it. Now coming to the treatment part, gastric lavage can be done with olive oil. Olive oil. In case of carbolic acid, usually we avoid with other things, but can be done with the help of olive oil. Can be help with the olive oil. Now alkaline poisoning are more dangerous, and alkaline poisoning can lead to the liquefactive necrosis. The most common symptom what we can have here is what, sir? Esophageal spasm, esophageal spasm, esophageal spasm. Thank you so much.